Hi, myself Dr. Shweta. I am here to discuss about pediatric sinusitis. As we enter the cold and flu season, this sinusitis cases become the most commonplace we encounter in the everyday OPDs. So what does this sinusitis means? Before that, let us know what are sinuses. These sinuses are air-filled cavities present around the nose in the face. Usually, all these sinuses are not developed at the birth of the child. Maxillary and ethmoid sinuses are present since birth, but their development completes as they advance with their age. And sphenoid sinus most of the times develops when they attain the teenage. Frontal sinus completes its development by the age of 7 years. The frontal sinus develops by the age around 7 years. What happens in the pediatric age group is whenever the season is cold and the recurrent attacks of rhinitis, upper respiratory tract infections takes place, these sinuses becomes blocked because of the inferior turbinate hypertrophies, increased nasal discharge, thickening of the nasal mucosa. These sinus clearance becomes obstructed, leading to the sinusitis. How we can manage this pediatric sinusitis is, we can manage the case by applying the Nagara Lepa or Rasnadi Lepa around the sinus area like maxillary, frontal and around the nose. We can apply the lepas and leave it until it becomes dry, and this should be done 2 times a day for 3 to 5 days, accompanied by steam inhalation and warm compresses. This condition can be managed very well, but there are some criteria where where a doctor decides to prescribe antibiotics. Such conditions are if the child is suffering for 10 days of headache along with nasal discharge, it could be purulent nasal discharge, and high grade of fever for 3 days, and upper respiratory tract infections, especially when the child is presenting with a biphasic symptoms. Like when we treat the case, the symptoms will go off, and again the persistent recurrence of headaches, when it starts, it's a time for antibiotic therapy. By this way, the pediatric sinusitis can be managed very well, but the case should be managed with LEPAs or steam inhalation or warm compresses, nasal normal saline sprays, or it is a case for strict advice of antibiotics. It should be decided by a treating physician. Under the guidance, the case can be managed. This is a small information regarding pediatric sinusitis. Thanks for watching the video.